Hey everyone, happy 4th of July. Welcome to another Carethriving video. This is Alexander, and today's topic is we're going to look at and talk about med charting. So when Irene and I first came home from the hospital with Hezekiah, the doctors released us, discharged us, I think is the proper word. We were discharged from the hospital with our little one, and we had just a boatload of different medications. So they're kind of like, okay, here's all your stuff. Good luck, right? So, and what we found is there really wasn't any best practice. Nobody said, okay, once you get home, this is what you do, right? And one of the things that we ran into is there was more than a couple occasions where one of us would be up all night or we had very little sleep. Now I'm talking about myself personally. I had an instance where we were doing medications with our little one, and I'd given him one of his anti-seizure medications, which are pretty specific in dosing and concentration. And a couple hours had gone by, and I was very fatigued and very sleep deprived, and I couldn't remember if I'd given it to him or not. And as a parent, that was a really scary place to be. And if you've ever experienced that, then you know just what I mean. So after talking with my better half, Irene, she is just a whiz at Excel. And together we developed, it's gone through several generations. We developed, actually mostly her, I give her credit for the wonderful design and layout, a med chart that helps us track our little one's medications, dosages, bowel movements, BMs, and different things like that that are really relative to his care on a daily basis. And I'll try to stop saying it. So there's a lot of reasons why this is nice to have. And first, I just want to clarify that what you're seeing here, in case there's somebody out there that doesn't understand, the medications that you see listed here, this is not prescriptive, okay? This is not a recommendation for your child. Only the sheet is the recommendation. So the layout, right. So this is not prescriptive. This is just an example of tracking medications. It's not meant to be suggestive for specific dosing or medications with your child. You should ask your doctor about that, just in case there's some confusion. So with no ado, we'll just go right into it, and we'll just talk about a little bit about what we have here. So, and at the end of this, we've actually included this Excel sheet in the comment section. I think you should be able to click and open it on, and you can download it. And if you or you know somebody that's is good at Excel, it's pretty easy. You can download it, and then you can make it and modify it to suit your own needs. All right. But at least this gives you a template, something to work with. You don't have to, reinvent the wheel from scratch, we're hoping this will be helpful. So in a nutshell, what we have here is we've divided the top to morning, lunch, afternoon, and nighttime routines for a little one. So maybe you have different things, or we had specific things rather that we wanted to have done for Hezekiah. So in the morning, we wanted to make sure that his face got washed and his hands got washed and his teeth got brushed, and we have a stretching routine. And we wanted to make sure all those things always happen in the morning, whether we're caring for him or maybe we have a support worker working with him. But this gives something to track. And then we have a lunchtime routine. There's nothing listed here, but you can list your own if you want something for your little one. An afternoon routine, and then a nighttime or bedtime routine. So an example here is, washing your face and brushing your teeth before bed. And that way you can track. And maybe you have a spouse or another family member. Somebody comes in, you can say, hey, did so-and-so get his teeth brushed last week or yesterday? And then you can look at this and you know what's happened. You don't have to go from memory, which is really, really nice. So our little one is tube fed, and so we have a food section here that goes from left to right. And so we have details about breakfast, lunch, afternoon, and then his evening meal. And we have instructions like feed every 4 hours. You make it from start to start or start to finish. And then you can make recommendations on the quantity of feed, how much water is mixed with it. and then the rate, and then maybe if you have a flush, it's important to flush the tube with water afterwards. So if somebody comes in, they know the routine. It's a good reminder. You don't have to explain it over and over to people if there's care workers involved, or even just to remind yourself, in our case. And then typically what we do, like with this medications, like here we have the medication area here, you see meds, and then we have 8 a.m. meds, and it goes from left to right for his 8 a.m. meds. And then we have a second feed, certain vitamins that we do with the second feed. And then he has 2 p.m. meds, the time is there, and then his meds go from left to right. And something that was really helpful for us is when you're dealing with meds, maybe you have a lot of them, the bottles all look the same. And, if you're in a rush or you're trying to do meds, you might think, oh, it's med time. And, you grab all the meds and set them on the counter, where it's a lot easier to make a mistake when you're dealing with 6+ bottles at a time. So what we found, what's really helpful as a best practice, is to pull out one bottle or one med at a time, do the dosing, put it away, do the next one. So typically what we do is, like, let's say somebody was going to pull baclofen, they pull the baclofen, and what we found helpful is we list the dose and we list the concentration, and this should match the prescription. So somebody can come in, or we can come in, and we can look, and we know that we have a current dose and a current prescription, and that everything is current for him.
And what's nice about that is there have been occasions when we got a medication from the pharmacy and it came back as a different concentration. So anytime we get a new bottle or there's any question, having it on the chart helps us ensure that the concentration didn't change. Because if it did change, then we also need to adjust the quantity.
That's a great point. And yeah, I mean, you assume pharmacies, they never make mistakes. Well, when there's humans involved, mistakes happen. And we've had more than one occasion where a prescription has come back wrong from a pharmacy. So this gives you something you or anyone else can reference to. And in dosing and in best practice, like I said, recommending doing one medication at a time. And typically what we do is when we pull a medication or pull the dose, we'll make one line through the box. And then after the medication has been administered, we come back and we complete the box. So an X means that he's received that medication at that time. And then we just go down the line dealing with one medication at a time. So you have an example of meds. Here's some vitamins that we found that have been helpful with him. And something that Irene added, which was really nice, is that he is fed via a G tube through his abdomen, and there's a little pigtail, for lack of a better word, or an adapter tube or extension tube that connects to the button and then goes to the feed pump. And it's important, at least we were told, to replace the tube, the extension tube, every 3 days. So what Irene made is, this is a calendar for the month, and the red days are the days that extension tube should be changed. And then she made an X here, so if today is the 4th and his extension tube was changed in the morning, we would mark it with an X. That way we can go back and we can look and we know that we're dealing with an updated extension tube and that it was replaced for sanitary purposes. So that's really helpful. And circle it. Go ahead, honey, please.
Then the other thing we do is each day we'll circle the day, and we do keep track of previous day's chart, so we don't throw them away at the end of the day.
Exactly. We use a 3-hole punch, and we just keep this in a binder 1 month at a time, and it's a great reference to go back for tracking if you're dealing with any medical staff or a palliative team or hospice team or doctors or people that are coming on site. People say, hey, when was this bowel movement? When did this happen? If you're charting behavior problems or issues, you got a record right there. Boom, you can pull it open and you can go. So one of the things that was helpful for us, since our son suffered from seizures, is we were really trying to track if the medication was being helpful or not. We were really looking for patterns, and we were warned, and we warn anybody else when we were dealing with seizures. Sometimes you can drive yourself crazy. There is no pattern, right? It's a full moon and the seizures go crazy, and you just don't know. But at least we were trying to make some cause and effect. If a medication was helping, if a certain dose was helping, at least we were really striving for some sort of metric to see if things were making a difference. And if they weren't, then maybe we need to readdress it with our doctor that, hey, he's a lot more sleepy or he's a lot more agitated. And we had something tangible we could show a doctor, and as opposed to, you go see your doctor after 3 months or a month, and he's like, how are things going? You're like, okay, I think. I mean, you can't remember, but at least having something grounded like this is really helpful in those situations. So another situation or another issue that we have is we have PRNs. So PRNs, it's Latin, and I forget the actual Latin adjective, but it's
As
based
required,
as
probably.
as required. Yeah, excellent. So we have ibuprofen, some clonidine, and some Valium that he rarely uses, but this was really important because there were certain medications that it's dangerous if they overlap. So this allowed us to use, like, we can mark, I gave him ibuprofen, and we would mark, 4.5 mils, and then the time, 4:30 a.m., and then we draw a line. Well, he can only receive ibuprofen every 8 hours, so 4, 5, 6, 7, 8, 9, 10, 11. So we'd mark that till 12 o'clock. I think that's 8 hours. Am I doing the wrong one? See,
Okay, normally it would be
Irene's going to save me here.
You'd mark that, and then you gave it at 4:10
Oh, there we go.
a.m. and you gave him 4.5 milliliters,
right?
And you can't redose him until whatever the requirement is on that medication.
Right. So that's great. So in this case, you won't run in a situation where, the little one's really agitated, or he's he's teething, or making some situation where we feel a pain reliever, and I would give him a dose of pain reliever, and then let's say I leave, and Irene comes in, and she's like, oh, I think you need some pain reliever. This way she can go, oh, he received it, 3 hours ago, and I can't redose until this time. So this is really helpful that you don't overlap doses or give more medication than is recommended for the little one. What else can we talk about here? So Irene made a neat little thing where you can make a little inspirational comment, which is nice every day. And then what we also charted is therapy. So our little one has therapy, and he spends a lot of time in a stander, and he's very floppy, so he has a lot of problems with head control. As we mentioned, our little one Hezi, he doesn't sit up on his own, and so we don't know if he's ever going to walk, but we've tried to really try and force whatever therapy that we can with him. So we have tracking for therapy. Maybe you have therapy for your own little one, and you want to track that every day he does a certain amount of time. So we have little stars, for standing or in the stander, intervals. Did you do 15 minutes in the stander, or 30 minutes, or 45 minutes in the stander, and how much time we want for a certain goal. And those you can go over and reference the goal with your physical therapist or occupational therapist, and go off of their recommendations. Did we mention that this is not prescriptive? In case there's still any confusion, that this is just an example, and we're not recommending specific medications or therapies for your child. This is just what we do for our own little one, and so trying to make it funny again. Hopefully that's clear, but you never know with people. So like I said, this is just an example and not our recommendation. Just the format is nice for tracking physical therapy and medication. So, and here we have a notation. So maybe there's a certain something in his behavior, or something you want to chart or make a note of. Our little one's having hiccups after he has a certain medication, or maybe he's agitated at a certain time of day, or he doesn't have a BM. Our child has a lot of problems with dystonia, so we tried to mark where his dystonia was on a scale of 1 to 5 or 1 to 10, and that gave us some background to see if a certain medication was helping or not. Also BMs. You never want your child to have a blockage, and charting his BMs, we do small, medium, large, and then we write the time. That way you can go back and reference, has he had a BM in the last 2 days or not, or whatever time period that you feel is appropriate. Because things happen. People get busy, people get sleep deprived. And that's really helpful for charting the BM and the size. And we know that if he's had, we know what the typical size of Hezekiah's BM is. And let's say he goes 2 or 3 days where he's having little small ones, and we're like, he's getting backed up. And then we know maybe we need to add some medication as a laxative to help him get regular. So that's helpful. And this is something that I found, I asked Irene to add, so is a print date. So something that we experience is we print off these, like a week at a time. And one time they had gotten mixed up. We had made med changes, and the sheets looked very similar, but there were changes, and they had gotten mixed up. So Irene added a print date. So if I know this is printed on 6/10/19, if it's the most recent one, I can reference this and I look at it, and I know that if they got mixed up and all of a sudden I see one in there from February, then I know immediately it's not a current sheet. So this having a print date, and this changes every time we print it. It automatically will change whatever the date is printed. It automatically reflects this on here. You don't need to manually do it. And then we added a seizure tracking little measure down here. So seizures, this starts at midnight and goes to 2 and 11. And so this, we can track seizures, the time that it happened and the quantity, 1, 2, 3. You can make a star, you can make a line, but that's really helpful. So anything you want to add, sweetie?
That's it.
So that's kind of it. And then, like I said, you can find an example of this spreadsheet. You can download it, and at least you have a template that you can modify it. And you can add your own medications. And if you have a nursing aide or doctor, you can send it to them and check it off. But we've showed this to a lot of people, and they were just really overjoyed over it. And I think one of the biggest problems that we saw, and also what was relayed to us, is not being in a medical field and not being in a professional atmosphere, like at a hospital where everything's charted and documented. You're in a home atmosphere, and we're not used to these type of best practices. But if you're caring for someone, especially in a pediatric environment, charting, having a record, trying to find patterns, and documenting as much as you can in daily care, it's going to be a win-win for everybody, and it's really vital for somebody, especially if they're medically fragile, as in our case. So that's it. Hope you find this helpful. You can leave comments, but again, download this. If it's going to be helpful, modify it to your heart's desire, and that's it. Okay. Till next time. Oh, and be sure to subscribe if you want to see more videos like this, and that's all.